Benjamin Netanyahu once said, "The right combination is between a free economy and a social policy which addresses the needs of society and creates equal opportunity." Because I agree with his statement, I affirm the resolution. The United States has a moral obligation to adopt a single-payer healthcare system. In order to evaluate the resolution, we must establish the obligations that a government has, so morality is the paramount value. Applied to government, actions are only moral if they're fair to the citizens of that government. So the obligation of a government has to its citizens is to ensure a fair society. John Rawls' theory of justice gives us the criteria to determine what is fair and why. Rawls argues in his book A Theory of Justice for a veil of ignorance, a position from which principles of justice should be developed. From this neutral perspective, those deliberating about the principles of justice would not know what socioeconomic class, race, religion, or gender they represent. Because the perspectives of the participants are neutral, those deliberating would create principles which guarantee protections to every group regardless of their status. Rawls argues for the first principle of justice, the equal liberty principle, which said that each person is to have an equal right to the most extensive scheme of liberties as is compatible with a similar scheme of liberties for all others. His second principle, the difference principle, says that the social and economic inequalities ought to be arranged so that they are of the greatest benefit to the least advantaged members of society, and that offices and positions must be open to everyone under conditions of fair equality of opportunity. Both of these principles aim to minimize the harms of disadvantages to those born in the most difficult positions. In a well-ordered society, we are either born to an advantaged class or to a government which compensates for our disadvantage. Rawls sums it up by writing, "The principles of justice are chosen behind a veil of ignorance. This ensures that no one is advantaged or disadvantaged in the choice of principles by the outcome of natural chance or the contingency of social circumstances. Since all are similarly situated and no one is able to design principles to his favor for his particular condition, the principles of justice are the result of a fair agreement or bargain." My first contention is that single-payer healthcare upholds the equal liberty principle. My first subpoint is that when someone is denied access to medical care because of their inability to pay, the equal liberty principle is violated, because she is denied access to the same basic scheme of liberties as everyone else, that is, specifically, the protection of their right to life. According to the United States Census Bureau, 14.2% of the U.S. population was uninsured from 2010 to 2014. This doesn't reflect the number of people who also have insurance but can't afford their deductible and therefore get access to medical care. According to the National Healthcare Quality and Disparities Report, quote, "Gaps in healthcare quality are particularly acute for certain racial, ethnic, and socioeconomic groups. Blacks and Hispanics experience worse quality of care for approximately half of the quality measures reported. Hispanics and Asians experience worse access to care for approximately 2/3 of access measures. Poor people experience worse care for approximately 2/3 of the quality and access measures. The truth is that health disparity in the U.S. is a huge problem. The current system effectively violates the equal liberty principle, making it unfair and immoral. Furthermore, untreated medical conditions, both physical and mental, can significantly prevent future expressions of liberty. For example, untreated illness can impair the ability to further education or business. My subpoint B is that a single-payer system would uphold the equal liberty principle. A single-payer healthcare system would allow some a chance to survive illness that they otherwise would not have had. David DeGrazia writes in his essay, "Single Payer Meets Managed Competition, The Case for Public Funding and Private Delivery," quote, "What a system of multiple insurers has to do is quite different from what we would require of a single payer. Profit making is not the goal of the enterprise. Breaking even is just fine. There's no need for competitive advertising because there is only one system. Everyone is permanently eligible for services, eliminating in one stroke much of the unnecessary bureaucracy. There is no need for experts to decipher rules and regulations of different payers because the single payer will apply the same rules to all enrollees. A single payer system takes the inequality out of healthcare, which means that the system is able to provide for the least advantaged and therefore is a moral obligation." But my second contention is that single payer healthcare upholds the difference principle. And the first subpoint is that a single payer system violates the difference, that a variable payer system violates the difference principle. Lack of access to mental health services perpetuates a cycle of poverty. A study published in the Journal of Psychiatric Medicine in 2007 concluded, based on statistical analysis, that those in poverty in the United States were much less likely to receive mental health care than their counterparts in Ontario or the Netherlands, both of which have a single-payer healthcare system. Furthermore, a separate study entitled "The Effect of Mental Distress on Income" finds that the relationship between mental illness and poverty appears to be self-perpetuating. Low income prevents the mentally ill from gaining access to mental health services to obtain treatment for their illnesses, and mental illness substantially reduces their earning potential. My final subpoint is that single payer satisfies the difference principle. A single payer system necessitates taxation in order to provide equal access to health care. This inequality is structured to benefit the least advantaged and therefore satisfies the difference principle. There can be no doubt that a single-payer system best empowers the disadvantaged to improve their circumstance. While no society can ever be perfect, a just society must strive to minimize the damage of its imperfections, because single-payer respects the basic scheme of liberty for all people and structures inequality to benefit the least advantaged. It is a moral obligation. I now stand open for cross-examination.
So, in your case, you talk about equality of opportunity, correct?
Yes.
Okay, so I'm going to ask you, what constitutes disadvantage?
There are a lot of circumstances that can constitute disadvantage.
So, a criminal who is a felon and it goes on his job record is obviously going to have a harder time obtaining positions.
What we're referring to is the disadvantages that come from your initial position in society. So the choices that you make that have negative consequences don't necessarily put you at a structural disadvantage. It's more being born into a class of people that is disadvantaged, such as minorities or people who live without access to certain resources.
Okay, but why should we ensure fairness? I mean, why should we ensure fairness for everyone? People make their own decisions,
Well, because that's the basic obligation of a government, is to make sure that its citizens are treated fairly. Otherwise, there's no reason for those people to be a part of that society. I don't quite understand what you mean.
Okay, but what happens when trying to treat everyone fairly and trying to provide everyone with equal opportunity actually violates the rights of others?
I don't think that ever happens, because I think that the only circumstances in which you would have to take resources from one person to give them to another is to compensate for an injustice. So I don't think that it's ever the case that you have to actually violate justice in order to ensure an equal basic scheme of liberties. I think that that's what defines justice.
Okay. To what extent should the care be covered?
I'm not proposing a specific policy application of single payer, but under all single payers that I'm aware of, it's universal access to all medical practices.
Okay, so let's say somebody has a life-threatening condition, they have a heart attack. Isn't that medical care covered under the current system?
If someone has a heart attack, yes, they could go to the hospital and get perhaps life-saving medical care, yes.
Okay, so then to what other extent would a universal health care provide besides that?
Well, because there are years of other systematic problems that lead to heart failure. One doesn't just have a heart attack. It's the fact that, if you're a member of a disadvantaged minority group who never goes to the doctor, doesn't realize that you're at risk for a stroke or a heart attack because of your cholesterol, that you never have access to resources to learn about how to lower your cholesterol or have any idea of your health condition, one of the basic tenets of modern medicine is that the earlier the diagnoses, the more likely you are to prevent a bad outcome, like needing to go to the hospital for a heart attack in the first place.